Gormaga Count Corla, and I want to thank the ministers for being here today. Minister, you spoke earlier on about the need for a global solution to the COVID-19 crisis, and you're right. I've been in here multiple times now, putting questions to you and making statements on matters pertaining to COVID Count Corla. And I have to say, something that I am quite disappointed with at a European level is the European Union's attitude to, I suppose, a multilateral approach to research in the area of antigen testing and having a set antigen strategy across the European Union. We know we're going to be in a situation where we cannot get our entire population inoculated during the 2021 period. And there's a significant risk that this entire year will be lost because of COVID-19. That is neither your fault or any minister of this government. But what we should be trying to do is invest in ways and research into ways in which we can give people the ability to live alongside this virus to some degree. And antigen testing offers a channel to do that. And I can't understand at a European level why that's not being done. And the question I'd like to put to you, Minister Donnelly, is when you're at your next meeting of the Council of the European Union in terms of meeting with your health ministerial colleagues, could you please put that point to them? And also, I want you to feed back the disappointment that I have as a parliamentarian, and I'm sure others here have as well, on the European Union's, I suppose, performance in the area of COVID. It has not been up to scratch. I think the Commission have let us down quite badly, and I say that as somebody who is a proud European and very pro the European project. And I think we have to feed that message back that they have not lived up to their expectations, and they have to do more. So, Gormagat.
Can I thank the deputies for their questions? To the question on rapid testing, I think it's a very good, a very pertinent question, and actually I have raised it with the Commission and raised it with the other health ministers that there should be some centralised validation, centralised clearinghouse, some sort of coordination in terms of the ability to validate and then deploy antigen testing, and also to share information across the EU. What I can say to the deputy is, I think there is a bigger opportunity to use antigen testing, to use rapid testing in this country. What I have set up is an expert group chaired by Professor Mark Ferguson. He's the director of Science Foundation Ireland and the government's chief scientific advisor, and he is looking at a quick review to see what are the appropriate tests to use, where are the appropriate settings to use them, and how should they be used. And I know he's doing very good work. In fact, I had to miss, with much regret, a meeting as part of his work that he'd set up with a Nobel laureate on exactly that last Friday.